Of course, we're all stressed in this country, and as the economy continues to worsen, the stress of Nigerians continues to increase. And I've seen that impact in a lot of my patients. We come up with certain ailments and diseases that are aggravated by stress, and there is nothing feasible that they can do to tone down that stress, to relax, because they have to survive. Let me share some of the interactions that I get on a daily basis regarding some of my patients that come in. I once saw a pregnant woman that came into the hospital with complaints of rupture of membrane, meaning her water broke. She was having contractions and she was in labor. This woman was unbooked, meaning she did not do antenatal in her facility. And to my surprise, she did not do antenatal at all. This was her first pregnancy. She was obese, and checking her blood pressure, we noticed that she was hypertensive. So she had done no ultrasound scan throughout this pregnancy, did not take any medications, did not see any doctor to manage some complications that may come with this pregnancy, because this was a high-risk pregnancy. She was over 35 years old, and nothing was done for her throughout this pregnancy. And now she just came to the hospital to deliver because she heard that my hospital was a good hospital, and that was her reason. It was so sad and shocking to me because, first of all, this is a high-risk pregnancy and she was not aware, and there might be some complications associated with her delivery and she was not aware or counseled. So we don't know the presentation of her baby, we don't know the position of her placenta, we don't know anything about this woman, and she was just here to deliver. So at this point, we have to start getting her scans, getting her tests done, serology, know her blood level, because it's her first pregnancy. It was just so sad that it's at this moment we have to start telling her that there might be some complications associated. Oh, your baby is too big and you might not even be able to deliver vaginally, and she's already in labor. You can imagine such a situation. That's what we face in this part of the world, whereby patients are worried about the expenses and the cost of coming to the hospital, that they would rather stay at home and come when they think is the best time. If this woman had presented earlier, we would have been able to counsel her on the do's and don'ts, especially for this her pregnancy. We're able to counsel her that, first of all, she's high risk. Why is she high risk? She's over 35 years old. She's morbidly obese. She's at risk of hypertension in pregnancy. She's at risk of gestational diabetes in pregnancy. And this can also cause her baby to be big, which means that she may not be able to deliver vaginally. Also, she might also suffer from preeclampsia, which is severe hypertension in pregnancy. And then her baby can also suffer from hypoglycemia after delivery if she has diabetes in pregnancy, which can cause sudden death in the baby. So the baby will require a facility that has a neonatal intensive care unit to properly take care of the baby. We'll be able to carry out the essential blood works, do a full blood count, check her sugar levels, put her on proper hematinics for pregnancy, do ultrasound scan to access the fetal well-being of the baby throughout the pregnancy. So you can imagine she came at 9 months ready to deliver the baby without any workup prior. This is not right.